Good morning, Dr. Maryam Al-Jalahmi.
Good morning.
Your Excellency, Dr. Maryam Al-Jalahmi, the Chief Executive Officer of the National Health Regulatory Authority in Bahrain. Dr. Maryam, it's great to have you with us this morning and to spare the time to have this session, disease prevention and the treatment. Thank you very much and for the information you shared it with us. I would like to mention that we are in Bahrain, all the citizens and residents, we are greatly appreciate and observing and watch what the government and what the authorities are really doing to prevent this disease. And as you mentioned, I put it like the motto, the 3 T's, track, trace, and treat. It's fantastic, It's I think one of the few countries in the world which they are doing this, And really appreciate that because it's under the leadership of His Royal Highness Sheikh Salman bin Hamad, the Prime Minister, the Crown Prince, and the Prime Minister. And wish you good luck and hope soon we'll get rid of this and back to our normal life. Socially, economically, and back to, we really get fed up for what we are living. I'm sure you agree with me.
Yes.
First question, which we have, has the COVID-19 been detected in drinking water supplies? If not, is there any risk that might be considered an alarm?
Thank you very much. And of course, I'm honored to be with the Rotary Club event. And thank you very much for inviting me. Up to date, the research have not proven that it is a what we call like a waterborne or foodborne virus or disease, because diseases have many, or viruses or bacteria have many modes of transmission. Some of them are called foodborne, where they are transmitted by food, or they are waterborne, transmitted through water, or airborne when you breathe. But this virus is a droplet. It is transmitted by droplet. That's why they say when the person talks, the virus gets into the air and then falls down. That's why the 2-meter distance. Because if it was airborne, then there's no use for the 2-meter distance. So it has nothing to do, it's not a foodborne, it's not a waterborne disease.
Maybe by, somebody say by touching or by touch some
yes,
areas.
Contamination.
Okay.
Yeah, contamination as well. Yes.
Do you think we should, another question, all wear these smart watches which monitor everything as a way of preventing illness?
Yes. We as a regulator have been approached by well-known international companies nowadays where there is a electronic devices attached to the watch where it reports your heart rate, respiratory rate, and blood pressure. I would say this is the beautiful advances of medicine, because now everything is been organized. And I think during the pandemic, I have seen that the important use of telemedicine, like we do the teleconferences now, where there are some companies we were able to link the results to the physician of the patient, especially people suffering from heart disease, diabetes, hypertension. And when there is an alert, then the physician will also know and monitor through the week what happened, or they can call the doctor and confirm it by proper investigation. So it is, yes, it is of course not for the infectious diseases, but for chronic diseases, it's a very valuable measure. I do agree on it. We have regulated that, and we gave approval for such devices and any telemedicine that helps you get consultation while you are at your home.
Thank you, Dr. Maryam. This is a question from Annie Mazagbian from Rotary Club of Amman, Jordan. The role of NGOs. Did you take special measurements dealing with persons with disabilities so that they can be treated, vaccinated, and the treatment?
Yeah. Well, let me mention that maybe something while I was listening to my speech. I didn't mention the role of volunteers and NGOs, and definitely volunteers and NGOs have supported us in many ways, either bringing volunteers, helping support patients. Even when we opened quarantine places, they supported with the patients with like when there were children quarantined with toys and laptops and bringing volunteers. Their support was excellent. In regards to the handicapped patient, the government has provided home services for the patients and elderly or bedridden patients where they get tested at home, they get vaccinated at home, or they can have a home visit by community nurse. And we also empowered the private sector to do those services, even for positive cases.
Thank you. Dr. Maryam, what are the post-COVID-19 complications that are found and reported?
Yeah. We have seen some cases where there is persistent positive results. At the beginning, we used to keep the patients for 2 weeks or 3 weeks until we get negative results. Then, as you know, this is a new virus and we've been learning through the past year how it reacts. And then if all the countries, CDC and WHO, found that after 10 days, the person doesn't get infectious anymore. And even if it's persists to be positive, then it may be just sitting parts or the dead virus, because the PCR test is very sensitive. We have seen people get complication in the heart, mostly, or lung complication, where they get embolism in the lung, and that's a very serious disease. It may lead to sudden death. That's why the issue with this virus is that you might get inability. I mean, you've seen pictures of the lung. They are filled. They're white. I don't want to speak in medical terminology, but in general, because of thromboembolic nature, because it causes thrombosis and lowers the oxygen, but people don't feel it. We call it happy hypoxia, that oxygen is very low, they are still not feeling it. So they seek medical advice late. Some of them get embolism in the lung, and mostly are they cardiac or related to renal. That's why most of the people who suffer from complication and lead to death are those with chronic disease. And we found one item also very important. The obesity, morbid obesity, is one of the high risk factors. That's why when we decided to give a third dose, a booster dose, we decided to introduce it from age 50 and above, those with morbid obesity and those with chronic disease. This is the most important thing we have noticed for the course of the disease, of course. For example, we've seen people who die very young at the age of 30, but because of only one single thing, morbid obesity. And as I said, we have found even some not genetic, but I say certain genes, certain countries, they get more affected by the virus itself. But most of the cases that fill the ICU now and the deaths are mostly over 90% are for non-vaccinated people.
Just from my point of view, I mean, these complications, do you think it will affect, the other members of the family? And how far it will be affected them, and how far dangerous will be on them?
No, the complication of the disease is just related to the person himself or herself. The only thing that the members can be affected with is the virus itself, if they come in contact. Again, I would say the reason of the cases in Bahrain in this last month was due to more than one factor, but most of it was because it was in the non-vaccinated persons. In 42% of the cases were children because they were not vaccinated. And the mutants of the virus, how they change, and the variants, and how they affect us, because your immunity changes. But that's why we have more than one type of vaccine. And now Bahrain decided to mix and match, like what all other countries after Bahrain have seen, that this could be effective, so it will boost our immunity.
And of course, the immunity maybe depend also if somebody got the corona.
Yes.
Has been, and maybe it was not so much heavy or complicated, and it was mild and it passed away. And for the vaccination, the protocol now, it is only to take one vaccine, one time, one good dose. not 2 doses.
If you got the disease already, Bahrain decided that you get only 1 dose. Rather than 2 doses, because it will only push already the immunity you have. Now, other vaccines will decide also, like Pfizer and other ones are studying introducing a booster dose from the same vaccine as well, not only mix and match. Many people have suspected the type. Many people suspected the type of vaccine and efficacy, but that's not the reason of the rise of the cases. Because when simple question is answered, the rise is more than 90% in non-vaccinated people. So that answered.
Thank you, Dr. Maryam. Another question: what is the common complication that occurred on the infected death toll in the Kingdom of Bahrain?
The complication as a
common complication,
common complication would be the effect on the respiratory system. On the respiratory system, it's the lung function that's the mostly affected by the virus. But getting infected by the virus. But let me tell you one thing, that when we introduce the vaccines, all the vaccines introduced says that it prevents the disease. Vaccines prevent the disease. Measures that you do, it prevents the virus, because you could be vaccinated and get the virus in your nose when you do the PCR tested, but you are healthy because the vaccine prevented the disease. That's the difference between getting the virus as a virus in the PCR, and that's why that vaccine protects you, and when you get the disease. And that's what the difference between being vaccinated and not vaccinated.
Dr. Maryam, flu vaccine has become annual routine for some people. Do you think that corona vaccine will take a similar status like the flu vaccine in the future?
Well, it's too early to say that, because it's a new virus and we don't know until we get people fully vaccinated in the community, where we hope that more than 70%. And then research will continue to see how our bodies react. Maybe another booster dose will be needed, and that's it. Maybe it's going to be one of the seasonal vaccines like the flu vaccine we take. We still don't know.
Yeah, just from I got corona before, maybe 4 months or something, but really, Dr. Maryam, I didn't feel anything. No flu, no fever, no nothing. I mean, no chest pain, everything normal. Only what I had, nose running and simple flu. When I came home in the evening, my daughter saw me. She said, no, you don't stay. Now you go and check out. And I went to the hospital. I was normal, complete. I'm not. Yes. And I came positive, And I have, of course, to stay 10 days in the, and I spent the 10 days not feeling anything. So maybe my immunity. Or...
Yes. And I don't know, may I ask you, was it this year or last year?
No, this year.
This year.
Yeah, I think March, something.
Yeah. It depends on the type of variant of the virus you got. Some of the variants are like they say the Indian virus or the UK virus. It depends, and also on your body immunity as well, of course.
Yeah. I just recently I took the
more than 90%, maybe 94% of the people are they don't need treatment. And over 60% are asymptomatic at all. They don't get any symptoms.
Thank you, Dr. Maryam. This question from Raj Domani, Rotary Club of Manama. What do you possibly see as long-term effects of corona? Long-term effects.
So far, from the disease perspective, no term effects have been recorded. Of course, research will continue to see that, but it's a virus. Either the effect is within the period of infection, or if it causes a disease or death. But we have not seen long-term effects like other vaccines that we see and vaccinate the children for, like measles, that may cause brain damage. This has not been seen or recorded yet. Nothing. Not yet.
No. From Riman, how successful is the app which tracks the side effects of the vaccine, the app?
Yeah, it's very successful because it helps the people. It helps Ministry of Health track all the minor or serious side effects, because sometimes, only serious, if you don't have an app, and people would seek the hospital only if they have serious side effects. But if they have minor, like fever or local pain, they don't want to go to the hospital. So it's easy to report it by phone. And we are mandated by the manufacturers of vaccine to report anything about the vaccine, because this is how they will track their vaccine and say our vaccine is that percentage causes of symptoms. So it's been very valuable for reporting, especially minor symptoms that people are reluctant to go to seek the doctor for.
Another question. We're taking so much time, but we have many questions coming, and really appreciate your presence. Dr. Maryam, another question from Osama Al-Muayyad. Are there cases of people getting sick twice? Getting maybe what he meant, getting corona twice?
Yeah, we very, very limited cases. We have seen people get twice. Even it's reported internationally, and they say it's either related to the type of virus, the variant. Maybe you get another variant, or the immunity is not being enough, and you might get reinfected. But it has been very rare cases.
Thank you. Another question: what information is available about the safety of the vaccine? We have different type of vaccine. Should be some yes, information about the safety. Yeah.
Okay. So basically, I am the CEO of the National Health Regulatory Authority. This health regulatory authority in Bahrain is like the US FDA, Food and Drug Authorities, or the MHRA of UK. So our role is to license and give emergency authorization to use medications or vaccines or medical devices. So all the vaccines that have been introduced to the country pass through the NHRA evaluation, where our pharmacists, our clinical trials committee, and in collaboration with the immunization committee and the Ministry of Health, study the papers or the documents presented by the company in terms of the clinical trials to see the safety. We have seen that all the vaccines are, and we can say that they are all safe to be introduced. Otherwise, we would not have introduced it. There have been reports in some countries where some types of vaccines causes thrombosis or embolic. It's been very limited cases that it does not require to stop the vaccine. But the only difference between the vaccines is the efficacy, where when they say that this vaccine is 80% effective and the others are 90%, it's not on the person themselves, but in the community, where they say if we vaccinate 100 people, if I say 80% never got the disease, then it is an 80% efficient. So that's why we never introduce a non-safe vaccine, and we follow the same regulation as the WHO.
That means to follow this answer also, that means you have some reports made a comparison on the effectivity yes. of each vaccine, I'm sure.
Yes, and you have seen, we do that based on the clinical trials they did, but we do also our own reports. And maybe you have seen that Russia has announced Bahrain's results on the effectiveness of their vaccine, Sputnik, based on our follow-up, local follow-up. We have seen how effective the vaccine is. And they published our results.
I have a question here. This is about the pets. What about the dogs, cats? Can they get it and transfer it to the human being? Or?
We have seen some reports of cats or dog who got the virus, but not in Bahrain. We have not seen this. So there have been few cases reported, but it's not something solid that we can comment on. I see there are some questions regarding the vaccine. Do you want me to answer them?
Yeah. Yeah, but I have a question, from Widad, after 2 doses, I think, from Sinopharm.
Yes.
Can I take the 3rd shot of Pfizer?
Yes.
Asking
I'll
question.
tell you why. Yes, I'll tell you why. We as I told you, vaccines differ in their efficacy. Some vaccines, we have seen that the immunity decrease by age. So the older you are, the immunity will decrease more quickly than if you are still young. And those with chronic diseases will need a 3rd booster. So the 2 doses are not enough. So we start, because other companies did not still decide on the 3rd dose, we found that because we have started Sinopharm very early in Bahrain, and most of the population are vaccinated by Sinopharm. So we had opened the option. We want to give a 3rd dose for all. But we started with Sinopharm because most of the population taken Sinopharm, and because it's been more than 6 months for taking the vaccine. So that's where the immunity might drop, not only for Sinopharm, some may stay up to 8 months. So we started with this, but we opened an option. You can take a 3rd dose of the same vaccine or the other available vaccines. But our recommendation for above 50 with chronic disease to take Pfizer. Now, why? Because you had the privilege of taking a vaccine with different platform that use inactivated virus, and it boosts your immunity when you get this dead virus in the body, while the other, like virus, use a messenger RNA and put the spike of the virus in it. It boosts immunity even more. So you can take any one of them, but if you are above 50, I would recommend taking another type, Pfizer, Sputnik, whatever available.
Dr. Maryam, before this question, you were going to say something, I think, about some, you want to mention something. And after...
I was going to answer the same question.
I see, okay.
About the vaccine, yes, the booster dose.
Okay, great, thank you. And last question, because time is running. Can you explain the antibodies number? You hear different numbers?
Mm-hmm. Yes. Yeah, well, let me tell you first, we use antibody testing, and we have different types of antibody to test. The most specific one to the vaccines is called neutralizing antibodies. And usually this is done for research. Like when we did the vaccine trial, we wanted to see the response to the vaccine. It has to be a very specific antibodies. Now, during the beginning of the pandemic, many countries demanded from their citizens, if they are traveling to that country, is to bring, beside the PCR, an antibody test. And because we are not doing this test, so we permitted the private sector to do it. It's general IgG, IgM antibodies. When you ever get a virus or get the disease itself, it comes up for a short period of time and differs between one person to another. So we permitted this in the private, and then the people started using it to test whether they got the immunity after the vaccine. But because they are non-specific, that's why we say don't depend on this. You can do it to see if you have immunity, but it doesn't mean your vaccine is working or not, because there are more specific antibodies used during the trials to test the efficacy of the vaccine. So, and it doesn't really reflect whether you are immune and you can take off your mask. So we don't highly recommend it. It is there if in case as a traveling request is needed.
We hope.
So we opened all the choices. You want antibody test, you want PCR test, you want rapid antigen test, it's also available. And the rapid antigen test, we are now permitting it depending on their sensitivity. Very high sensitive, yeah.
The most important, as you said in the beginning, to track.
Yes, yeah. Track and then trace the contacts. Contacts are very important. Trace them and quarantine them before they spread. Absolutely. And I would highly recommend using rapid tests at work, big family gatherings. If you're doing that, test everybody before they come. Personally, when my children want to meet with their friends, I give them rapid antigen to test it before they meet. So it's a valid tool, a quick
and when
tool.
they come back, and when they come back,
when they come back, maybe next day. Yeah.
Absolutely. We hope, inshallah, in the near future, to see a light in the end of the tunnel, get rid of these pandemics, and go back to normal life, to our social life, to our business life,
Yeah.
because really
Sure.
it affected us badly. Dr. Maryam, thank you very much.
But may I say one thing? Yes,
please.
true. It affected us badly. But there are many positive things during this time that we learned. A lot of things that we learned. We came very close together with the using the internet, using those gatherings, learn how to protect yourself. Have you seen people never get cold influenza during these 2 years? Because they were masks. They clean their hands very frequently. And this habit should be maintained there. I would certainly say, even after the COVID finish, if you are sick, wear a mask. Don't infect other people. Don't use the habit of kissing people in the gathering, in the weddings, and these things. These are healthy habits that we learn. This is very important. It should stay with us even after the pandemic.
Absolutely. I'm facing this with my family, my son and my daughter. Always wash your hand, put the mask, don't touch. I said, take it easy. He said, no, you have to watch yourself. Dr. Maryam, thank you very, very much for an excellent session and for the great information and useful information to us. Wish you good luck in your responsibility and wishing you a wonderful day. Thank you very much.
Thank you very much.
Thank you. Back to Lamis.